to participate today, and also that Dr. Flagar, who is one of our senior residents and will be starting his own practice in a few months, for him to be able to join as well. As a way of background, we are both family physicians, and a lot of folks who are diagnosed with dementia or Alzheimer's problems ultimately end up seeing a specialist. They end up seeing a neurologist many, many times, but usually that process starts by going to your family physician or your general internist, and that's where the conversations begin. So as a way of background, well, I should say for myself, I don't think Dr. Flagar is also an expert in dementia or Alzheimer's disease. I would say that we are family physicians. We certainly see people with memory problems and concerns about dementia, but just as a way of disclaimer, neither of us would claim to be experts on the subject per se, but I think with our specialty, we're usually the first point of contact.
As Dr. Mass said, I'm a resident, so I'm finishing up my specialty training in family practice right now, and that's at Firelands Regional Medical Center. And I'll be in Toledo actually when I'm done at the end of July. And as Dr. Mass stated, I'm certainly not an expert. I'm still in training, so I was excited to be invited to this to answer, to help answer your questions, but also just so I have an idea of what the patients, what kind of questions people will be having when I get out there. And I have a little bit of a background in emergency training too, so that's not usually, as Dr. Mass mentioned, the place that people would go to when that happens, but there is a role, there in the emergency room too, where when the patient comes in with dementia, how that can affect their care. So. Right.
Okay. Would anyone like to start off with any question? Because if you don't have one, I do. Anybody?
I'll start off with
Okay, Paul.
When you think like you don't remember things the way you used to, when how do you know when to say something to your doctor and feel like a fool,
So embarrassment, first of all, I think we're all preoccupied with misusing your time. We know that you've got probably 20 other people after you see us, so we don't want to consume your time with something that really doesn't matter. So what do you wish we would tell you if we have concerns about our memory?
I think that there is oftentimes a misconception that it's wasting the doctor's time to come with a concern. My line that I tell people is, look, ultimately people go to the doctor for advice. And so if you have a question, it's the time to answer it. I think it helps if you specifically say, I would like to schedule an appointment with my doctor to discuss this issue, because that way the doctor knows what's coming in. I don't think that it's an embarrassing topic to talk about. I will tell you there's a lot of issues that we see people for that I think are probably more embarrassing to them, whether it's dealing with their anatomy or their sexuality. There's issues that are oftentimes a lot harder for patients to discuss. What I would encourage folks to do is, if you have a concern about memory, make that the reason for your visit. Oftentimes people come in twice a year to see their doctor, and I need to recheck my blood pressure, and we should talk about my arthritis, and I need to get my pneumonia shot, and all these other things. And deep down, the patient is thinking, I really wanted this visit to be about my memory concern, but after the doctor's already spent 30 minutes going through everything else, and then it finally comes out, then it's difficult to give it the time that it deserves. So my advice would be, don't hesitate to schedule an appointment and specifically say, the reason that I'm here is I'm having concerns about my memory, because that will give the doctor sort of the open end to say, well, here's how we're going to pursue checking it out.
Dr. Flagar, anything?
I would just add that if it's enough to be of a concern to you, you're not wasting our time. If it's enough that you're concerned about it, then we're there to field those concerns. And like Dr. Mass said, it's always better if that's if you make an appointment just for that. So because it deserves a lot of attention,
Cheryl.
As of January 2011, there's a new Medicare benefit for those of you who are in Medicare, and that is that you can get an annual checkup. Well, part of that checkup is supposed to include some sort of cognitive assessment The doctors have had no guidance as to what kind of cognitive assessment. It could be that they've known you for many, many, many years, and as they explore how you're doing, they realize there's been changes, or they might do something very formal, like a certain screening test. But that could be part of your new Medicare benefit for a checkup is a cognitive screening. Screening, of course, not a diagnosis, a screening.
What's the difference between the two?
And you can correct me if I misspeak. So a screening would alert you like, uh-oh, could be a problem. Just like when you get a blood sugar at a health fair, and they say blood sugar's high, better go find out why. Now it might have been high because you just ate a big old donut, but maybe it's high because there's a problem. So it's just a little alert,
Well, can you go to your doctor and are there tests that they can give you to decide? Everybody, even young people, forget things. So how do you know when there's a problem and not just something that you forgot overnight or something like that?
I think that's part of what you're going to the doctor to try and sort out. And I will tell you that being on the doctor side of that, it's not always easy. But that's part of what the evaluation is to try and sort out. Is this a normal age-related memory loss, or is this indicative of something more?
Yeah.
Our job, when a person comes with a memory problem, is to try and determine how serious is the problem, what other testing is there to do. The testing may involve everything from a simple physical exam. There is a questionnaire that is often very commonly used, which asks some really basic questions like, what year is it? What month is it? Can you spell this word for me? Can you follow this command? They're very simple tests, but based on how a person does on that can really give a sense of how severe the problem is. It's one thing when a person says, I was talking to an old friend and I couldn't think of their name at that time. It's another thing when a person says, I was driving to Walmart and I got lost and I ended up at Cedar Point. Well, it's funny that folks chuckle because those are the sort of things that we try and iron out, because one is very different than the other. And helping to understand just what is normal versus what is abnormal, that's really part of our challenge. And then there may be blood tests and there may even be x-rays that are done to try and see if there's an underlying problem that might cause it. Because a lot of medical problems can cause memory issues. Everything from diabetes to a low blood count to an underactive thyroid to depression. All of those things can affect memory. Our job is to try and iron out what's going on. Is it something that we can maybe even fix? Or is it something that's going to be progressive, like a dementia, like an Alzheimer's process?
So is there a basic test for you go to your doctor? Is there a basic test that he would give you and say, hey, you're having a problem, or was it just, something that happened that day?
There may be some day.
Can you repeat her question?
And the question is there just a test? Is there just some test we could take and find out it's some sort of dementia? There may be someday. The research is getting closer and closer, but right now it's exactly the way Dr. Mass described it. It's a matter of looking deeply at you, trying to figure out, is there some other medical condition? Do you have low-functioning thyroid? Do you have a tumor or something? And ruling out lots of things. And then ruling in everything that looks like dementia, like I got lost, because how odd is that to go to Walmart and end up at Cedar Point that wouldn't normally happen to you. So ruling out and ruling in. But researchers are coming up with tests. There's a new PET scan, and it uses, you know how your brain uses glucose as one of your major fuels, sugar? Well, there's the regular PET scan looks at how your brain is using glucose.
What is a PET scan?
It's like it's an imaging. It's not an X-ray. It's not a CAT scan. It's yet another imaging way. Well, there's a new one coming to town. I wouldn't be surprised if we're here within 5-6 years, where they inject something else into you, not glucose, and it attaches to certain proteins that are involved in Alzheimer's disease. They put something in there called the Pittsburgh compound, because it was invented in Sweden. But they're using it in Pittsburgh, and it actually gloms onto this protein called amyloid. There's gonna be tests. And they're also looking at ways to draw spinal fluid and look for a different protein called tau. There's gonna be tests. But right now, that's why Dr. Mass says it's hard. It's hard. You gotta rule out and rule in and think real deeply. And sometimes I get troubled when I hear people say that they went to a brand new doctor, never met them before, and they came out with their script for Aricept that very same day. I wonder, wow, how did they know so quickly? Because it's actually complicated.
And we had a question over here.
Yes, thank you. In relation to your comment about the annual exam that Medicare was providing, I recently did that and learned at the doctor's office that the only thing they were really addressing was a question and answer kind of thing, like what is your weight, for example, and discuss that. But no kind of screening or evaluation, just to see if you were up to speed on things that you needed to tend to.
So to get a baseline. So it was just an interview to find out where you are, so they have a baseline.
Exactly.
Oh,
And if I'm hearing,
so
if I'm hearing your question right, which I went.
Can
for
you
my-
repeat that?
I went for my new Medicare benefit annual screening, and they asked me questions about weight. But were you also saying they didn't ask me things that would be testing my cognition?
No, they did not.
In the physician's defense, and you can correct me if I'm just being too optimistic. The fact that you are able to answer questions like that and how you answered them kind of is a cognitive screening. They haven't had guidance as to which screening tool to use, and so they're each approaching it a different way.
That's what I'm kind of thinking, that I don't know if the physicians have had enough information to inform them of what kind of benefit this should be. And I had gone, just a bit personal, but I had gone with some concern about my hearing. And in order to see the specialist, I needed a statement from the doctor that it was not something they could just clean out, et cetera. And that really was not an acceptable reason to come for that annual exam.
Would either one of the doctors care to comment on the new Medicare benefit that she's
My
discussing?
interpretation of the new Medicare benefit is that it's a chance for you to come into the doctor and do all of your preventative medicine type stuff and get a baseline picture of what's going on with you. So to know what medicines you're taking, you know, what vaccinations you've had, what other doctors you might be seeing and why you're seeing those doctors. It's kind of to get a big picture. And then if you have a specific issue, you know, that would be a separate visit.
That's the way most people have interpreted this. It came out as part of the Affordable Care Act, and it's officially referred to as the Medicare Annual Wellness Visit. It's the AWV for short. And I will tell you that it's been a relatively new animal, and a lot of doctors are trying to figure out, what exactly do I have to do to use that code for this visit? Because normally I would have just done X, Y, and Z. One of the things that has come out of it is if a patient comes in for the annual wellness visit, Medicare is pretty clear, that's what it's there for. So if you say, by the way, can you look at this mole? You're actually not supposed to do that. Medicare, their guidelines are that should be a separate visit. Now, some of us feel like, well, that seems like 2 trips. Sadly, that's really the way the guidelines are going. So there is some confusion about that, both on the aspect of patients as well as the doctors.
Okay, go ahead. Right there in the front row.
Does that include, I guess, what would be considered standard blood work to see if certain numbers are within acceptable parameters?
The annual wellness visit,
Yes.
to my knowledge, that does not routinely include lab testing.
Any other
I
questions?
hope I didn't just misspeak and tell you.
I actually I have a question
Go
about
ahead.
that's directed towards Dr. Mass. But would that identify if they needed additional lab work? That's what I kind of thought.
If you
that-
come in and everything is A-OK normal, then doing routine blood work just for checkup purposes is not routinely covered. If you came in and as part of that visit, your blood pressure, which normally was okay, was sky high, Well, now we're gonna do blood work because you have blood pressure problems. So blood work to follow up on something identified in that visit, I believe, is covered in the usual way that Medicare covers other things. But routine blood work, just for the sake of doing it, is not a part of the annual wellness visit benefit.
And so, then I'm thinking your question about, I'm here to complain about my hearing, that's not part of the wellness visit, it's a separate concern, and maybe even a separate visit.
Right, and that was what occurred, and my only concern was that I didn't feel like it was clear to,
The doctor.
it sounds like he was pretty right, but it hadn't been made clear to the patients what that kind of visit would be, and so I had gone with that in mind, and that really didn't happen, which was fine, but I think that he had a better understanding than I had.
That's why it's so cool to get actual doctors here that we can talk to.
The insurance system is complicated, whether it be Medicare, whether it be private insurance or Medicaid or workman's comp. It's a really, really complicated system. And once you figure the rules out, they change them. And then it's confusing all over again. And then you think you're doing it right and somebody says, those guidelines changed like 3 years ago, you can't bill it that way. And you say, I was just trying to help the patient that time. No, you can't do it that way. You gotta bill it out this way. And it's unfortunately a complicated system.
Was there another, I see Sharon had her hand, and then I'll get to you, but was there a person up front?
Up front,
Okay,
yes.
sir, go ahead.
Hi, my name is Ned. I wonder if you have an answer to what affects memory loss. Somebody just mentioned depression. What are the other known effects that are connected to memory loss? Is there such a list?
How about some of the rule out sort of things?
Let me rephrase the question. What are some of the things that, medical problems that can result in memory loss? Was that your question?
I guess. Depression was mentioned.
Yes.
That's tied to memory loss.
Yes.
What other things might be tied to it?
That list is very long. There's a lot of medical problems that can result in memory loss. Depression is a common one. In fact, depression in the elderly is oftentimes referred to as pseudo-dementia, because people come in looking and acting like they have maybe an Alzheimer's dementia, but they also have depression and it's manifesting itself that way. And if you treat that, the good thing about that is you can treat depression, and that memory loss from depression can actually go away. Underactive thyroid can do it. Certain vitamin deficiencies can do it. Syphilis can do it, an uncommon disease nowadays, but syphilis can involve the brain and can do it. Those are some of the common ones. Give me some others, doctor, I'm
What they'll
forgetting.
see in the emergency room is a urinary tract infection.
Infection.
Urinary tract infection, but medications can sometimes cause memory problems.
Can you elaborate? What do you mean by that? Like, I'll take a medicine that doesn't agree with me, or there's interactions, or what?
I could give an example.
Okay. Yeah.
Some drugs, like antihistamines or drugs for urinary incontinence, have what they call anticholinergic effects. Cholinergic, what's that about? If you've got one brain cell talking to the next brain cell, it's got a chemical in there called acetylcholine. Well, some of the medicines interfere with the brain cells talking to each other. So, for example, we had a family member call us. Dad was in the nursing home. He was just admitted. His little comfort medication that would settle him down was always, he would take Tylenol PM. It has like a little antihistamine in, would make him a little drowsy. It was just a little comfort thing to settle him down. Well, he was real upset being in the nursing home. And they thought, well, let's give him 2 or 3 of these. Well, antihistamines have this anticholinergic effect. It interfered with him being able to think clearly. And so he got more and more confused. So drugs that we think of, I don't remember antihistamines or urinary drugs being a problem. I never read about that in the McCall's or Good Housekeeping. There's lots of drugs out there we don't know as regular consumers how they affect our brain. So medications can actually interfere with one brain cell talking to the next brain cell.
How about alcohol?
And alcohol definitely.
Yes.
I don't mean that.
No,
I just wondered if that really does have a connection.
it can, yes. Especially if you're a chronic alcohol drinker. You know, if you drink
Individuals who chronically consume large amounts of alcohol can develop something it's kind of a syndrome referred to as organic brain syndrome. And that's kind of a catch-all to say long-term heavy alcohol use can damage your brain. And how does that manifest itself? In a number of different ways, but memory is one of them.
You know, before we,
Something you don't hear much about. Something you don't read much about.
Alcoholism and aging, you rarely find anything about, unfortunately, but it happens all too often.
and I don't want to leave this subject yet before we get to this lady here, of how medical problems can make a person confused, okay? And then maybe we do have to come back to alcohol too.
Okay.
Not being a scientist, I have to explain everything to myself in social work terms. And I used to teach a course called Biology of Aging, and this is how I came up with it, and maybe it'll help you. I think of all our body systems as being on a threshold. Let's say it takes this much heart power to get through the day, this much lung power, this much kidney power, this much cognitive power. We know what? Young people are up here. They've got lots of extra capacity in their very body cells, in their very cells. And as we get older, we get closer and closer and closer to the threshold until finally, one urinary tract infection, bingo. One thyroid problem, bingo. One broken hip, bingo. And if the doctor can restore you to health, you won't be young again, but at least you'll be able to think. You know, so how can medical problems cause memory problems? Why would that be? It's because we're cruising close to the threshold, and you've overstressed yourself, and things like that. Does that help at all?
Yeah.
So that's how can medical problems cause confusion when it's not dementia.
Sharon, and then
A lady in a
guest-
gold shirt.
Sharon can't remember what she had.
Yeah, I remember what I asked.
So Mary, and then we'll go to the guest on.
I'm wondering, could it be genetic? Because both my husband's brothers and sister were diagnosed with Alzheimer's, and now he's suffering with it.
Don't know. There's clearly some genes that are related, but how important they are still being figured out. But you see it run through families and you know it's clearly happening.
I wonder if I should apprise my children of it so that they watch for early warning signs
In you or in themselves.
themselves. Well, myself as well. I know the signs by now.
Open conversation never hurts, as long as it's done with tactfulness and tenderness and sure.
Thank you.
I'm sorry, I stepped on you. Did you have a different set about genes?
Yes, ma'am.
I have a question about what you can do to kind of forestall the advances. I have a genetic disorder and see a neurologist. And so he's always asking me what I'm doing to keep my brain active. And I said, I do crossword puzzles. He says, well, that's excellent. I think that very day I read in the paper where that is not, that type of thing is not what you need. What you need is stuff, exercise that provides oxygen to the brain, which is a lot healthier than sitting and doing a puzzle that makes you think. You need the oxygen.
Can you repeat the question so the rest of the audience can hear?
Can we prevent problems with their thinking? Can we prevent Alzheimer's and other dementias? And this lady says, and for example, I have a neurological condition, she said, and my neurologist checks in with me like, what you doing just to keep healthy? And she says, I've tried crossword puzzles. Yeah, like 3 years ago, that was all the rage. Everyone was going to do crossword puzzles and Sudoku and everything else. You know, research is still in its exploring stage for all this stuff. It seems to be clear that until the scientists come out with an actual honest-to-goodness prevention, you know, how to get these proteins from you can get in your brain, All we can do is stay as healthy as possible. One little thing you'll say is, whatever is good for your heart is good for your brain. Well, exercise is great for your heart, and it turns out it's great for your brain. And it's not just about oxygen, it's not just about, getting blood to your brain. Exercise releases all kinds of hormones and different chemicals, and it's still a mystery, but people who exercise regularly, and by that it was walking 3 times a week, have, it gobbles up some of that amyloid that was getting to the brain. So right now, all we can do is stay healthy. But no one ever figured out how to prevent a heart attack. No one ever figured out how to prevent a stroke. All we do is reduce our risk of heart attack, reduce our risk of stroke. Let's try to reduce our risk of dementia. Let's reduce risks rather than adding to the risks by all the stuff we know, smoking and not exercising and eating fat and things like that. We can at least reduce our risk until the science kicks in.
And the first thing that we talk about is do no harm. You certainly would not be doing any harm by reading the crossword puzzle and keeping your mind active. In addition, physical and mental exercise. You're not doing any harm by engaging your mind as well. But you're right, the physical part is also a very important component, I think.
Yeah, I have to agree. Although there is some harm with Sudoku because it gets addictive. It's going to interfere with your life.
You're not eating because you're doing Sudoku.
And any other questions? I can, our experience in our office is the fear of sharing concerns with the physician when the older adult has noticed changes in their memory is, I don't want to tell my physician because he's too powerful or she's too powerful. The concern may be that I'll begin losing control of what happens to me. And could you put those fears to rest, Dr. Flagar? What power does the doctor have and not have? And what happens when you begin talking to your doctor about your concerns about memory?
I mean, I think that when you begin opening that conversation, our number one obligation is to serve you, the patient. And when you open that line of communication, I think that you probably have some relief, something that's been on your mind and you can get some of the answers to. I would think that would hopefully be helpful. As far as our power to, I'm not sure what I mean.
Tell them it's time to move out of your house and live somewhere else?
We may make recommendations, based on what you're telling us. Recommendations of, you may want to consider having, is something like moving out of your house could be a potential, but I certainly wouldn't think that would come up right away unless it was a pretty severe situation. But we would make recommendations. Nobody would force you to do anything, and just basically opening up those lines of communication. I think that's the most important. Did that answer the question?
I think that's helpful. Mr. Wilhelm.
Yeah, I go to the doctor. I got all kinds of doctors. But anyhow, when I go to the doctor, I always take my wife with me. Because first thing out of the doctor's mouth, how you doing? Hey, I'm okay. But I tell her when we walk in, you blab on me. And I think that would be a good rule for anyone to go to the doctor, have a sister or wife or somebody that they're around, accept the fact that they can go with them and blab on them.
It can be really helpful and eye-opening because, like you said,
I don't think there's anything wrong with me.
I'm fine. I feel fine. Yeah, and then the real issues end up coming out from whoever. But yeah, that's a good point. And sometimes family members may notice things that you're not noticing as well. So,
What do you think of having a family member in the room?
I think if the concern is memory, it's beneficial. There are times you don't want a family member in the room, But if a person truly is having memory problems, and so I start asking them about their memory problems, they may not remember. So if you're really having memory problems, how can you remember if you're having a problem? Or maybe you remembered it yesterday. I have a family member who has Alzheimer's, and I will tell you that he doesn't remember the memory problems that he had a few days ago. Everybody else does. So bringing somebody along who can say, well, actually, remember that thing yesterday? Was that yesterday? Did that happen? So I think it's helpful. It's helpful to get another set of eyes and ears.
The other side of the coin is, you go and the doctor goes through everything, and sometimes rather fast. And you get done, and you walk out, and, you know, what did he say? What did he tell me? Where, if I, you know, my situation, you know, I go with my wife, only because, you know, when we get done, I said, no, they said this, this, and this, and she, okay, and then what this, this, and this. You know, not necessarily, you know, blabbing, but just necessarily just getting the information and getting all the information.
And I'm just gonna restate your comment for the camera, that he brings his wife with him, not only because she could provide what Cookie's wife provides is telling the truth, but also just to keep track of, I heard him say this, and then she'll say, and I heard him say this, and then together they come up with their picture, combining their memories.
Suppose
Yeah.
you don't, oh, I'm sorry. Go right ahead.
Can I make a quick comment?
Please.
I always recommend, you know, don't be afraid to ask your doctor to write things down for you, because we do cover a lot of information in a short amount of time, and some of the words that we use are foreign and you're not used to hearing those words. So I wouldn't be afraid to ask the doctor to write it down for you.
How's your handwriting?
Well, you should check, you better check that paper too, but yeah. And also coming prepared to the doctor with a list of questions is always a good idea too, because there's always something that you might forget, and then you're like, oh shoot, and it may have been really important. So writing things down, I think, is really important.
In advance of your appointment.
In advance of the
Okay.
appointment.
And
yeah.
then we had a question up front, did we? And then we have a question here.
She meant you.
I remember mine.
Okay, all right. Well, the woman in the front row, go ahead.
I have just gone to my doctor, and I feel like I'm getting into this memory loss. And she gave me a patch to put on right here. And she said, this is new on the market. She said it may help me or it may not. You put on a new one every day. I'm not sure that it's working, and I don't know that it will.
Okay.
And can you
She said that, I went to the doctor, complained of memory, she looked me over and she says, I'd like you to try out this patch. And you put a new one on every day. And she says, and I'm not so sure it's working. In fact, I remember a fellow in our early stage classes, do you happen to know if the name of the patch was Exelon?
Sounds right, it's just a small one.
Almost certainly. So this man in our early stage classes, here's my problem, Cheryl. I'm using this Exelon. Exelon, if it works, because it seems to have some effect on about 2/3 of people, 1/3 none, instead of having, I need to start speaking kind of frankly, and I don't mean to cause pain to anybody, okay? Instead of having a decline that could look like this, maybe you'd have a decline that looked like this. And he says, here's my problem, Cheryl. I'm getting worse. I feel myself getting worse steadily. And I don't know, am I one of these people or am I one of these people? And the only way I can find out is stop taking the patch. And if I go bang, I know I was one of these people. So it's true. It's not going to maintain you. It's not even going to improve you, although some people sometimes get a little boom. But if it works for you, it slows the decline so that you don't have to go this direction. I don't know if that's very comforting. But it's the only game in town.
Okay. And we had a question here.
Mine's sort of related to that. If someone is taking Aricept or Exelon, and then they have some injury or whatever, and they have to have a pain reliever, are there any pain relievers? I mean, like you mentioned the antihistamine one, or you know, with the antihistamine, are there any they should avoid because they're on these medications because they could interfere or reduce its effectiveness? Yes, thank you.
I would say it's less an issue of being on Aricept or Exelon or Namenda or any of those other medicines. It's more the nature of certain pain medicines that they can cause, at least temporarily, some memory problems. If you're in the hospital and you've had surgery and now you're getting pain medicine after your surgery, pretty heavy duty pain medicine like morphine or Dilaudid, things like that. Again, these are commonly used in hospital settings. Do they cause memory problems in the short run? Absolutely. Most people don't take that sort of stuff in the long run, although there are some oral medicines like that, such as Vicodin or even Tramadol, some other ones there, that have the potential to affect memory. The good news is those medicines don't worsen the underlying problem of dementia. It's just, we're getting back to the issue of side effects. So if you have an underlying problem with dementia, and then you have something on top of it, whether it be an infection or whether it be a medication, certainly it may worsen it in the thick of all that. The good news is that once all that washes out of your system and you get back to your usual baseline self, you should be at the same baseline. Does that answer it well?
Very, thank you.
Sharon.
Okay, back to your wellness visit. I don't understand what, if they don't take your blood pressure and they don't do that, how do they form their baseline? What criteria do they use for that wellness visit that says this is this and this and this and this, and if she's not this, this and this the next time I see her, something's wrong? Well, what is the baseline? What do they base it on?
And let me add to that, especially as it relates to assessing their memory. Because once again, if I'm going to a new doctor and you have no idea how well my cognition is, if, like what Sharon said, if nobody's doing a baseline on that, how do you know the next time I see you if I'm better or worse? And if you don't have an answer, that's okay. We're just seeking.
Well, and I think I might need to rephrase the question a little bit. It might not be, the question might be, so what is included in a wellness visit and how do you use that?
Yeah, I think.
I'm not just surfing on my phone. I'm trying to find this on Medicare's. Medicare's a website. Have you all ever been to Medicare's website, medicare.gov? You can go there and find out exactly what goes into these visits. Part of the challenge is, as we stand up here, to be able to recite chapter and verse what all goes into the annual wellness visit. I don't want to misspeak it and then miscommunicate it to you. There are components that have to be there. I believe that checking vitals is part of the annual wellness visit. If you give me a second, I'm trying to load it on my phone here.
This is bigger, it might be easier to look at.
But you can clearly go online and you can pull this up, and there are guides for doctors and there are guides for patients about what these services are intended to include and exclude.
But to your point about if you would like your physician to have a baseline about the wellness of your cognition, if you can't get it taken care of at the wellness visit, you should do what he recommended, and the next time you make an appointment, say, I want to see you, and I want to see you because I want to talk about my memory, my ability to reason, think, process information. So when I see you, that's what I'm coming to see you for. Cheryl?
So give a plug for that. What's that nurse's name that works with you?
Tina Elmer?
I can't remember.
Okay.
But anyway, give a plug for that series. We're trying to learn how to run that computer. I mean, I wish I could, but I'm getting there.
I'll do that after the
Right.
talk. And then we had a
Everybody here should
gentleman
be there.
right there in the second row. Please go ahead with your question.
I change my Exelon patch every day. And if I forget, like maybe if it didn't work the day before, I know it. If I go a day without it, I can tell. It's not drastic, but I can tell. And one other comment, I don't know whether I'm the only one here that's hard of hearing, but I'm missing some of the questions because of my hearing. If they could be repeated or...
That we should make an effort to repeat every question and comment.
Okay, I appreciate that.
And so his comment was that he does find that when he misses an Exelon dose, he feels a difference in himself. That
Maybe it's psychosomatic, I don't know, but.
or maybe not.
I do notice it.
And he doesn't know if that's just some placebo effect or if it's real, and I don't know either. But you're not the first person to say that. Well, thank heavens you weren't around in the early 90s. The only drug in town was one called Tacrin, and you had to remember to take it 5 times a day. How would you like to have Alzheimer's and remember to take some 5 times a day? And only 20% of people could tolerate it.
Any other questions?
Well, how do you decide whether you're getting Alzheimer's? Does somebody, you live with, if you live alone, what do? You go to the doctor for your annual physical and he might say, well, she doesn't sound so good, but how do you know? Can you tell yourself that there's something wrong?
And actually, she says, so how do you actually know it? Especially like if you're living by yourself, how do I know it? I go, and this is the same woman who says, what's my test? And so that tells me we haven't quite answered your question. How about if I try it this way? Alzheimer's Association, for example, has a 10 warning signs. Now, each of those warning signs could be just normal aging or a urinary tract infection. But let's say you go down the list and you say, well, heavens to Betsy, I have all 10 warning signs. That would send me to my physician. The physician, not having a single blood test or a single imaging test, will try various talking to ya and blood tests maybe if it seems needed, and imaging tests, trying to look deeply into and figure it out. And so it's not, I had it this way. One doctor says, I could be pretty sure it's dementia after I've done all my thinking and my figuring and my tests and everything. I can be pretty sure it's dementia, but we don't have just a single test there to figure out what's going on.
If you have, I'm sorry.
No, go ahead.
If you have blood work done, your annual physical, your blood work and all this kind of stuff is excellent.
But did they do blood work related to memory, such as the
Now,
thyroid problem?
Is there such a thing?
The thyroid problem, what other problems?
Vitamins.
Vitamin deficiency, B12 deficiency. So.
There are lots of blood tests that your doctor may run as part of a checkup visit. But if the blood work is being done to try and look for a cause for memory problems, they may be ordering different things. So it's maybe more than just ordering a simple blood count, check your cholesterol. You may be ordering some different tests. Now, if those tests are all done and they're all normal, again, that starts to lead more to concerns about Alzheimer's dementia because, again, there's no test for it. Our job is to look for other things that we can identify and treat in the hopes that we can fix it or slow the progression of it. But by definition, Alzheimer's is something that we usually come to when the story sounds right and all of the testing is essentially normal.
And patients get frustrated. They're like, well, maybe you just missed something and I don't really have it. And yet you do. They can be pretty accurate if the picture is right. Everything looks like everyone else who has Alzheimer's and they've ruled out everything else. It kind of usually is.
Mary.
I have found with my husband, the first thing that happened was with him was numbers. He couldn't remember the zip code. Then he couldn't remember a telephone number. Then he couldn't even punch the numbers in if I repeated them to him. Another thing he could not do was draw a clock with the numbers in the right position. So those were 2 things that alarmed me right away.
So I guess what I'm learning from listening to this dialogue is you may think it's nothing that you can't remember your zip code. But what we just learned here today is if that happens to you or anyone you know, that is something you'd want to share with your doctor. Because if you lived in Sandusky, Ohio, and you've always recited your zip code and now you can't, that might mean something to a physician. Especially if you qualified that with, I'm concerned about my memory, and actually last week I tried to write a letter to my sister in Sandusky and I couldn't remember our zip code. Would that have meaning or relevance for you as a doctor?
Yes.
Because what you're looking for is change. What's changed?
The other thing I'm thinking when I hear you talk about urinary tract infections and medications with interactions, and Dr. Mast, you alluded to, there's some topics that are just embarrassing to talk about, and I know that I wouldn't look forward to a conversation that I have urinary incontinence. But if I'm thinking urinary continence is just normal older age, when really my urinary incontinence is because I have a urinary tract infection, which might be causing my memory impairment, is that a conversation I should be having with my doctor that I'm now incontinent of my bladder and I never used to be?
Absolutely.
And could that be responsible for some degree of my memory loss?
It's hard to know without ever drilling into it to figure out. But are these the sort of concerns that, as a physician, I would encourage people to have with their doctor? Absolutely. Because if your doctor doesn't know, then they're going to make decisions based on the best information that they have. And if they've only got a part of the story, but it's difficult for you to bring up the other part of the story because it's embarrassing, you don't want to talk about the fact that you got lost or that you bounced another check because you didn't do the math right in your checkbook, or that you had an accident with your bladder. Again, those are key pieces of information that I think your doctor would want to know, that I would want to know, because they help me have a better understanding of the overall picture.
It's like putting the pieces of a puzzle together, and the more pieces you have, the better idea of the big picture that you can get. So the more information, the better.
And we have Alice and then Shirley.
I was wondering, what does the creatinine test?
The creatinine? Do you want to answer that, Doctor?
Sure. So her question was, what does the creatinine test? And that's a blood test, okay? And what it does is it tests part of your kidney function. So it's taking a picture of your, kind of like taking a picture of what the kidneys are doing, okay? And that's a blood test.
Does that affect memory?
Well, if your kidneys are not functioning properly, then you can have the buildup of certain toxins in your body that could affect your memory. So yes, that could be part of the bigger picture.
Okay. And yes, please.
I have a question relating to time of forgetfulness, but I just wanted to mention about my other question about the doctor and the annual exam. I just wanted to say that the doctor, therefore, then did address my problem, and we just treated it as a regular appointment. So, in his defense, he did certainly go ahead and take care of things. My question is, I think a lot of people have some questions about length of forgetfulness. That is, it seems really common for people our age to forget for a moment or a few moments a number or a name or a word you're trying to express. And I think the question that I have is, how do you determine what length of forgetfulness is significant? That is, if you think of it in a minute or a couple of minutes, or you don't think of for a long time, that is a difference, is it not?
So let me repeat everything you said. So 2 parts. One is she says, and the finish of my story about my wellness exam is, the doctor did address what I came there for, and we didn't treat it as a wellness exam, we treated it as a regular. And then her memory question is, so everyone has bits of memory problems after age 45, and sometimes it can be just a brief, and then it came to me. Is there something related to how long my period of time of forgetfulness is? Does it matter? You're kind of asking a question that I haven't seen addressed in exactly that way. So my short answer will be, I don't know. But I'm Irish, so I always have theories for everything. And if we go back to brain cells, connect them to the next brain cell, we know that babies, just like the rest of their bodies, are so efficient and so great at doing everything in young children. One brain cell connecting to the next is quick, it's efficient, it happens easily. As you get older, it's not quite so efficient, and you can struggle a little bit. There is controversy as to whether that normal struggle ought to be called normal because it happens to like everybody, or if it's related to dementia and ought to be treated if we could figure out how to treat it. So the research is all over the place about that. I think most people are calling that those short-term memory problems. Right now we're just calling that normal, and that's what we have to live with. And understand you process slower, and just give someone, get their phone number, because at 3 in the morning it'll come to you, and then you could give them the information. It's being treated as normal right now, and I'm comfortable with it being treated as normal as long as we consider that our kidneys aren't working as well, and our lungs aren't working as well, and your stomach's not working as well. If that's normal, then I guess this is normal. But now we're into bigger questions, you know, like, well, should you stop aging? Should you cure aging? Should you... So that was kind of a long way of saying, I don't know.
So let me ask it, okay, so length of time, what about frequency of it happening? So if it happens to me 2 times a day, and after a minute or 2 minutes, I now remember my high school classmate's name, but now it's happening 20 times a day.
It does seem like as dementia progresses, these problems get more and more frequent, but as aging progresses, do they get more and more frequent? I don't know. Not sure.
Yeah, I would say that, you know, what you just said sounds like something that would be considered a significant change, which kind of would throw up a red flag and make me want to say you should talk to your physician. So if you notice a significant change, which significant you'd have to define yourself, I think that it could be, you know, maybe a potential issue. But again, the I don't know answer is, I mean, there's not a good answer for that.
Because we're back to the lady in the pink shirt or peach colored shirt, like, how can I tell if I have dementia? It isn't utterly 100% clear until it is. Until it is.
And I think part of the challenge that I hear in a number of the questions that are being raised is, how do I know if my memory problem is indicative of a dementia or not? I would argue that's why you go to your doctor to figure it out. Let me give you a different illustration that I think nowadays most people wouldn't sweat at all. If I'm having this pain in my chest and I think it's a heart attack, I don't want to go and waste the doctor's time if it's not a heart attack, do I? No! Call 911 and go to the emergency room now. And if they say you pulled a muscle, then you were on the safe side. But if you stay at home and have a heart attack and die because you didn't want to waste the doctor's time by checking because you didn't think it was bad enough, well, that wasn't a good decision.
Good example.
So in the same way, if you say, I don't know if my forgetfulness is normal or abnormal, and I can't figure it out, then go. That's why you have a doctor to help you sort these things out. And it's perfect. That's the reason that you're going to the doctor. You say, I have a health problem. I don't know if it's a big deal or not. You tell me. Sometimes we see people and we say, I know you're concerned about this, but it's okay. We can give you some good news. Sometimes people come in and we say, you didn't even think the visit was about this, but I've got to tell you, there's a whole lot more going on here. This is the tip of the iceberg for something big. You're going to a medical professional to get their judgment. That's what they're trained to do, is to help you sort these things out. If you're not sure, ask. I would rather people go and ask than sit at home and fret and say, I've been thinking about this for a year, but I don't want to bring it up to my doctor yet. Mm-hmm. Just bring it up.
And then another suggestion would be to, again, write the things down with specific examples of problems, memory problems that you're having. You know, how many times has it happened and what specifically it was that you were forgetting. keeping a log of all that stuff so that when you do go and talk to your doctor about it, it gives us a little bit a better picture to look at.
I really like your example that, when you can't breathe, you don't think, oh, geez, should I tell my doctor about my difficulty breathing? And we're all okay with that. We're okay telling the doctor, but when it's a specific problem related to the memory, now we're wondering, is that a waste of his time? So I really appreciate that analogy, and I hope the whole audience, if you're having questions about your brain's ability to function, it's no different than you're questioning your heart's ability to function, your lungs' ability to function. It's worth the physician's time to know. And then we have a woman in the second row who raised her hand and has a question.
Yes. What is the difference between dementia and Alzheimer's?
Her question is, what's the difference between dementia and Alzheimer's? So if dementia is the catch-all term, Alzheimer's is one of the dementias. There's other catch-all terms like flower. Like, I went out and planted some flowers. We all know what you did. And then someone says, well, what kind of flowers? I went out and bought a car. Well, what kind of car? I got dementia. What kind of dementia? But the difference is you can figure out what kind of car and you can figure out what kind of flower. It isn't always so clear which dementia.
I mean,
not always so very, very clear, especially if there's a mixture of things going on.
our kids, he has a worse memory problem than I do. Knock on wood. The girls say, you aren't Alzheimer material yet. It's dementia.
Okay, that's a misunderstanding.
So-
No, it's not like you start out with dementia and grow into Alzheimer's. It's more like you start out with dementia and maybe someday you'll figure out which dementia you got, maybe you won't. But you could still go ahead and read about Alzheimer's and use Alzheimer's Association services even though you don't know which, is it the Alzheimer dementia or is it vascular dementia? Is it Lewy body dementia? Because there's similar problems for all of them. So the dementia is the problem. It's the problem with your thinking, problem with your memory,
Well, we like to
problem
say
with functioning.
it's dementia, because it doesn't sound quite as bad as Alzheimer's.
I like the word organic brain syndrome, which you never hear anymore, because dementia to me sounds like demented.
Yeah.
And so that's not fun either. I like this idea of, or maybe chronic brain syndrome or something. I wish we'd get rid of both words and just use Alzheimer's if it's the Alzheimer dementia and chronic brain syndrome for the other one.
Sure.
Is there a treatment for either one? Are they different? If you have dementia, do they treat you differently than if you have Alzheimer's dementia?
Yes.
Or are they similar?
Well, this gets back to our earlier discussion about other things that can cause memory loss. Dementia is a catch-all term. I would say probably the best similarity is to use the phrase memory loss. Memory loss and dementia are largely two ways to describe the same thing. So if your dementia is because you have a very underactive thyroid, and you fix the thyroid problem by treating it, then your memory problems may get better. That's how you treat that kind of an issue. If your dementia is because you had a bunch of medications that were prescribed and they affected you and you can fix the medicine problem and the memory problems improve, that's how you treat that. If the dementia is felt to be from Alzheimer's, then the treatment is to use the medicines that we mentioned, like Exelon or Aricept, the goal of which is not to fix it, but to slow the progression of it. It's a chronic issue. Unfortunately, there is no cure for it. But the goal of the medicine then is not to reverse the underlying problem causing the dementia. The goal then is to try and slow the progression.
And if your dementia is a chronic one, that he says, or she says, you got dementia the rest of your life, and it's not Alzheimer's dementia, but it's one of the others, there's different kinds of dementia. So there's dementia, one's called vascular dementia, and it sounds like it's blood flows, little strokes. Another dementia is called Lewy body dementia. It's somewhat kind of like Parkinson's, but not really. There's another dementia called frontal temporal dementia. There's another dementia called Creutzfeldt-Jakob dementia, that mad cow. There's another dementia called Pick's disease. There's lots of different dementias, and if your question is, well, do we treat Pick's disease different from Alzheimer's disease? Now we're into the area of going to specialists and trying to figure out some of that, because some of those dementias have special problems, like they got lots of hallucinations. What are we going to do about that? Or this type of dementia has problems with, you know the word inhibition? Some people, dementia's frontal temporal has problems, disinhibitions. What are we going to do about that? So we use the Alzheimer drugs for all those dementias, and actually the Alzheimer drugs work better for some of the other dementias than it does Alzheimer's. So if your question is, if I'm talking about a chronic dementia, a rest of my life dementia, which might be Alzheimer's dementia, or might be one of these other catch-all dementias, do we treat them differently? Not really. You just look at each person and try to figure out, okay, you're having hallucinations, what can we do? You're having lots of anxiety, what could we do? You're having insomnia, what can we do? You seem to be losing your temper all the time, what can we do? Yeah. So if your memory loss problems are caused by something medical that's fixable,